computer. Okay, here we go. All right. So how's everybody? How are you, Barry? Right. I thought we could like just unmute, you know, when you need to. If you have background noise, just mute yourself and until you're ready to speak, so that you know I don't have to unmute you. Someone is saying I tried, and see, I'm feeling like.
Just please.
Give me 1 second.
I didn't do this to you when you were in your class.
I'm asking her to keep trying, and then we're going to be. Okay, so I'm going to mute everyone because I'm hearing some background noise. That way we can, yeah, that way we can have a, everyone can hear us. Okay, here we go. So who are the midwives here? We have Barri and we have Tania. Is there any other midwife that showed up today, or is it just the three of us? I think so. Okay, great.
I'm Karen. I'm also a midwife.
Oh, there you are. Okay. Are you a home birth midwife?
No, but I do home birth VA work with Yen.
Yeah. Oh, wonderful. Yes. So yeah, just you know, we love other midwives as well. So I'm glad you came. So that'll be a nice, interesting conversation to have with other midwives too. So what I have to do is I have to multitask because I have to keep admitting people as we're talking, but I'll do my best. Here we go. Okay, we're gonna start in a minute. Now it's not letting me admit people. Admit! Okay, all right, let's begin. Today, before we start, I thought we just introduce everybody. Karen has introduced herself. We will ask Barri to introduce yourself, please, Barri.
Hi, all. I'm Barri Malik, and I'm currently a home birth midwife with BK Midwifery.
In New York City, right?
In New York City, right.
And Tania? You have to unmute yourself, I guess. There you go.
Hi, everyone. My name is Tania Zirulnik. I am a home birth midwife as well in New York City. My practice name is Luna Homebirth.
Great. So any other midwives here? Okay, great. Then we can begin.
Well, there's you.
Oh, me. Oh, you know what? I should. My name is Kimm. My name is Kimm Sun, and I'm also a home birth midwife in New York City. So today's topic, we thought we would really talk about something called the home birth difference so that people would get an insight into what is it that we're doing for a whole hour just chatting with you. We're going to talk about prenatal care. And then in the following, the series, the next series, we're going to talk about labor. What's the difference? Like what is the home birth difference in labor? And then postpartum, what is the home birth difference in postpartum? So today we're going to try to focus on prenatal care. And then of course, if anybody has a question, wants to participate or wants to chat, because it's good that we have a small group so people can just like, you know, it feels more free flow and we can do that. I am no Tania Wills, okay? I am trying you know, so don't expect as much from me. This is my first time hosting. I'll do my best, okay? So, home birth, the home birth difference, prenatal care, and that is such a big topic. I just want to start by saying that, you know, often it's such a big difference that it makes that we don't really get that, especially I particularly don't get that many questions when people are interviewing us. We don't really hear people say, what is the prenatal care like? more like how many prenatal cares do you, how often do we see you, what are the transfer rates, and then when we take care of them, and then where they've given birth, they begin to tell us just how, like, what a difference that made. So, and I think this is really an important topic to discuss. And I would like to invite any one of the midwives to share, if anybody wants to begin talking about what you think is the difference in the home birth difference in prenatal care.
Well, I was thinking about this today, and the question that kept coming up for me is, why do we have prenatal care at all? Like, what is the value of prenatal care? I've worked globally in a place where people walked in labor and not had any prenatal care at all. And with a little bit of midwifery experience and ingenuity and caring in a facility in Indonesia, we actually had pretty good outcomes. So I think about what is the value of having people come, and how often, and what do they need. And so I think that, again, as we talked about last week, a lot of people think of prenatal care as just solely about the birth. But in home birth care, we think about you turning into parents. And so the prenatal care has the backbone, the spine of medical care, how the visits are paced, what tests we might offer, and in shared decision making you might decide to do. But a lot of the difference in home prenatal care is not just that you and the baby are alive after you give birth, but it's about you turning into a parent. And so I would start as that is the first thing I was thinking about, is the difference between home birth care, and how most of us do it is taking care of the medical in about 7 minutes, and then the other 53 really learning who people are as a human being and an individual.
I love how precise you are about the 7 and the 53.
I read that somewhere.
I totally agree with you, Barry, because I oftentimes feel that for the most part, we spend a big chunk of our prenatal visits developing a relationship with our clients. And it's not so much the patient healthcare provider relationship, but it's actually like a friendly relationship, a relationship of trust. And we oftentimes not only touch the preparation for the birth part, but how are you feeling? Is there anything going on with you today? Is there anything, and it may just be completely off it may be not totally pregnancy related, but maybe that person just needed to talk to someone on that day, and here we are. And because they already feel they have this relationship with us, they feel that they can just open to us and tell us that, which sometimes doesn't happen at an office. It's not as easy, also because it's only 7 minutes. And so I agree a lot with what you say, Barry.
Yeah. And the next thing that makes me ask, like, what is the value of that, right? What, bringing back to Barry's very philosophical and interesting question, right? Why do we have prenatal care, right? Right. So the question becomes, what is the value, Tania, of having somebody to talk to? What does that? How does that help? How is it important?
Well, because it affects the well-being of the person,
right?
Like going back to my example of, like, that person was having an issue and she just needed to let it out, and once she did that, it's like, I feel less stress, which is optimal for the pregnancy. I feel that now I'm gonna sleep better tonight. So again, it's less stress for the pregnancy, and now I can turn off that part that was concerning me, for example, and focus on my baby. And maybe my blood pressure will go down because I don't have that stress, right? So just kind of like trying to lump everything together.
Right. I mean, stress is already been such a, there is just a mountain of research on how stress affects pregnancy that we often don't really talk about, because it always appears to me that the people who are doing the research on stress don't talk to the people in the front line like we do. They seem to just like, stress affects your baby in so many ways. And then, in a completely different world, we are dealing with people who are stressed and like, okay, how can we take that information and help our people? Like, how do we do that? And there hasn't been a link to it. So I think that's a really important point you brought up about just just having stress reduction alone can play such a big part in the woman's birth outcome in general.
Yeah, so I'm thinking of a time that happened recently. Well, so there are certain tests that all of us are taught and we offer, and one of the common ones is we test for gestational diabetes between 24 and 28 weeks. And, you get this sugary drink, you drink it, an hour later they draw your bloods and they check for iron, and you might get a little explanation of why that helps. Well, in home birth, you get the next level of information about, we might get into more depth about how that test was created and why it's beneficial and what is the physiology. Okay, there's another little piece. But then when I had time to offer this test to a woman and talk about whether she thought that this would work for her and why the benefits are, she started to cry, and I was able to just sit there with her. And then she started to talk deeply about how she was shamed by her own mother around food and weight. And when she heard that she was going to have a daughter at the 20-week anatomy scan, she had been carrying this huge burden that she thought she had let go of in therapy, but she was afraid to have a daughter, that she would turn around and shame her own daughter about weight. And she was thinking a lot about it because she knew this test was coming up. And so we were able over the weeks, not necessarily therapeutically because she had a therapist, but we were able to really talk about not just testing. And she ended up failing the 1 hour and then having to take the 3 hours. So the universe really gave her a good grounding to speak about all this. But she was able to really take her time and let down the baggage from her past so that she could go into her future, even if she was triggered, not necessarily putting that burden on her child. And that's what I think all of the home birth midwives take time to do. We use what are good ways a lot of the time of judging whether you and the baby remain healthy, but they can lead into periods of growth for you to figure out who you are. And again, I keep going back, and how you want to parent, how you want to be in this world as a parent. So that's what I think we have time to do and the ability to do in home birth.
I think we have time to care for the human. It feels many times like the institutional care is caring for the baby. Like
Yes.
the baby is alive, and as if the experience that the mother is having doesn't affect, even if you did, let's say, admittedly say, we're only caring about your baby. Even if you did that, I think you should also look at the mother, because how the mother feels and what the mother is going through totally affects the baby. So there's no way around it, even if you think that was the only thing that was important.
Mm-hmm.
And I think
that is very true. I mean, and that's one of the reasons why so much has been talked or said about what's happening in hospitals, where it's like all the interventions for the baby, and then the baby's born and everybody focuses on the baby. And then you turn around and the mom is there, and maybe somebody would say, oh, and how are you feeling now? Or maybe nobody will, because now that the baby's out, everybody's assuming the mom is okay because the baby's healthy, right? So that's definitely a big difference, because when we're at home and the baby is born, and of course this will be talked more in detail on the next episode later. But you know, baby is born and is with the mom right there. So if we need to check on both, they're both together. We're checking on both of them at the same time, basically. Mom is not left on the side, because she's such a important component of this.
Right. I mean, it's almost like evidence of they have already shown that babies in orphanages, like in Eastern Europe, who have not been touched, cannot thrive. It's impossible to think you can separate the mother from the baby.
That's right.
And our sort of ethos is always about, like, if the mother is whole, we trust her to take care of her baby. We don't need to be fussing with her baby. She'll tell us what to do. And we're going to build that confidence and that connection. And that's kind of the idea, because, you know, midwife means with women. And as much as we love babies, I mean, I like to say, you know, like, you know, everybody's thinking, oh, you catch babies, they're so cute. And, you know, I think they're cute, yes. But whenever I'm looking at the baby, I'm looking at the baby in context with the mother as a whole, you know, like, and she bonded with her baby. That's more, really, truly more our goal than to think, what a cute baby, which is mostly what people tend to focus on. Even when they're doing postpartum visits, they're just like, oh, that's a cute baby. But, you know, we are with women. And I love what you said about parenting, because the way I face it, which means exactly the same thing, is I always think about the work being an intact bond with the mother and the baby. That's what I'm trying to preserve at the end of the day, that the mother and the baby are truly bonded. And when they are, and the mother feels empowered, then I feel like my job is done, because then that means that the baby is going to thrive. So this is circular talking. There's no way around trying to, you know, make a baby, like take care of a baby without the mother in it. It's just impossible. That's just not a thing. So
this is what, you know, we also get through the prenatal care, because we develop that connection with women, and we know what they want, and we know how to also respect their wishes for the birth, so that it has a meaningful, so that it's a meaningful experience for them, you know. And that's something that we learn through every time we come and visit them.
Yeah, one of the things that I always joke about when people, either at the consult or the first visit, they'll say, do you think I need a doula? And I'd say, I don't know. I don't know you that well yet.
It's true. It's true. And people have asked me that too, or who could you recommend as a doula? And I said, I first need to get to know you more, so that I can see your personality, and then I can recommend you the right person, or, you know. But it's very true.
Yeah.
The other thing that is that I think a lot about midwifery care and versus MD, the medical model, and we really truly get to do this as midwives as home, is in order to get our attention, in order to be with us, you have to stay well, because we basically take care of well women. And in the hospital system or in the medical system, you have to stay sick in order to get the attention and time that you deserve. And so the home birth model of prenatal care is all about staying healthy, about working toward health, whether that's physically or emotionally.
And then I feel that's like, for example, for me, especially I think on the first visit, we talk a lot about, I mean, not only nutrition, but other ways of keeping yourself healthy, right? Like whether you need to take prenatals or not, or exercise or not, or mentally healthy. It's very important to discuss that from the very beginning as well.
Right. So I always find it, I think the most challenging part of our job, at least according to me, is that we can never, like, a job gets better with time, and that you kind of know what you're doing. So we do know what we're doing, but the people change. So we are constantly having to get to know somebody all over again, right? Because we say goodbye to them after after the six weeks, and now we have a new relationship, and with each new relationship, women are so different. Humans are so amazing and so complex, and so I think a lot of that work, and then is not being discussed, is how much of that we give, as part of our care. And that takes a lot, because we're looking at you just as who you are, not on the assumption of who you are. And we know that you are going to come with your own needs and your own values. And we want to know that, so that we can see how we can play a role in empowering you, no matter what values you come with, right? So yeah, just reminded me of just how this work is just, like if there's any part of this work, it's always like, oh, there's a new person, and it's both joyful as well as, a lot of work, because you never know. Like if you build, like in any other job where you build a relationship, right? You have the same team members all the time. You don't have to worry about relationships. You just get on with the business. But in our business, is constantly like, we'll get on. We always have new people that we get to know. I always like to say, it's like we date you, we're so devoted to you. Yeah, you have all our love, and then we kind of dump you after. and it's a little heartbreaking. So I now make it a point to prepare my clients for that moment, that breakup, because it can feel, and as midwives, we recognize every aspect of the care, including the woman feeling of like separation from her midwife, who has been like such a big part of her very important part of her life. So just a thought around that as well.
Just to add a note on that, I had a client that she said, I really want to keep friends with you, so she made me her daughter's godmother. I was like, sure, I'll take it.
And the other thing that's so interesting is like we get so many invites for birthdays, and and if I get an invite, I have to be at a birthday every day. So so I always like send pictures. For me, it's like send pictures. That's what like keeps me going. Send those babes. No, even they're 10 years old, just keep sending me pictures. That's how I stay connected.
Yeah.
I think also we have thinking about all the women that I've cared for. We have, although I try to, I don't have quite of the words for this, but I know my sister midwives will help me. We have a non-authoritarian model, which I think is one of the reasons why less than 1% of people choose home birth. That's a whole nother discussion about why people want a little bit of authority in their life, but it's a non-authoritarian model. And in that model, I find with each client I have, to certain degrees, I'm given a gift of who they are. So in the prenatal care, you get to recognize that person, that pregnant person and their family might be coming into your life for a reason. And I just kind of joke about this. I was considering applying to, well, I did apply, but I decided not to go to therapy, a master's in therapy at NYU. And within 2 months, all of the patients, all of the clients that were coming to us were therapists. And I thought, well, how funny is this? Because then I got to ask them questions about the program, and I got to learn. And so although we are in charge and we are the midwife, just like there's a role of the mother toward the child, and I'm not friends with my clients, there is a real intimate relationship that develops. And each of us gets to give and receive in different ways. And I think that that can be really satisfying and nourishing for our clients too, as they travel this. You know, they want to be able to give something a lot of the time, more than just payment. And a lot of times they can give us information. The relationships that developed when the COVID-19 came out, so many clients wrote us, and a lot of clients asked, do you need supplies? Do you need this? Do you need that? And so there becomes maybe you guys can help me with the words, but it's a give and take relationship that is allowed to happen in that time.
It's just, I think of it as like, midwifery is a very unique, almost like we need to keep identifying, with the concept of with women, because we have a very unique relationship with our clients that it's like no other relationship.
Well, it's like a reciprocal relationship, right? I think maybe that's what Barri was the word she was trying to look, but it's like we give ourselves to them and, help them through this process. And in turn, they almost became, clients become, like there's that unconditional love over the years, like, out of the blue, somebody will say, hey, I was thinking of you, how are you doing? And like, that was like 2 years ago that baby was born. And, just randomly you get those messages and it's like, oh, thank you, So, and that just makes your day sometimes. Maybe that's just the one thing you needed. So that person didn't technically give you anything material, but gave you something that was very meaningful emotionally. So maybe, the word I would use will be reciprocal, if that applies to what you were thinking, Barri.
Yeah, so I thought we would take a moment to find out who the people here are.
Can I ask one more thing?
Yes.
It's because I didn't slip it in. I wanted, if you feel comfortable, Kimm, when we're talking about prenatal care, my clients and others have really benefited by learning about havening. Now, I know we all have skills that we bring to our prenatal care and work, but I thought if you just would take a moment to share about your havening, because it's something that you have more time for in your home birth prenatal care, if that's okay.
Yeah, sure. Thank you. Actually, I had an interview, a podcast today by Kate White, who does perinatal. She does a lot of that discussion, and so I was given a chance to talk about it. So it has been a nice. I was thinking like I want every midwife to know how to do this. I know you guys are busy and you already have your care, and when I'm listening to you talk, I'm just hearing so much of you giving this holistic care in your own unique way. Everyone is so unique when they are approached, because it's a human relationship and all humans are unique. And I was telling her that it's so nice to have a framework of that missing piece that makes the care holistic, right? So as midwives, obviously the care is, I'm going to admit another person, give me 1 second. So as a midwife, the care is truly holistic, meaning that we take care of the body and the mind. And I have incorporated this psychosensory therapy that becomes such a big part and an exciting part of taking care of the woman's mind, because we are able to offer sessions. So the 57 minutes that 53 minutes that you're talking about, right, becomes an intake or becomes an evaluation at certain visits of the woman's mental health. For instance, is she bringing something from the past with her? Did her mother have a traumatic birth? That is a huge thing we check off. What was her mother's birth like? Because we know that there's a very good chance, I'm admitting someone, there's a very good chance of that re-emerging, that her experience of a mother's birth emerging when she's in labor, right? Because if her mother had such and such a birth, even something like my mother had a short birth, and then in the labor she's going to, why isn't my birth short? And then that's going to to hold her back. But then there are other really more serious stuff, like if a mother never got to hold her, and the mother was always traumatized, and the mother had constantly talked to her about trauma. I never got to hold you, and that was the worst thing in the world. And then she's going to worry so much about her own bonding with her child. So, and then of course the very typical people coming in with a previous birth trauma. So that has been like a gift for me to be able to not only like take care of it, but be unafraid, like, because I know some midwives, and I feel that way a bit about you guys, that you have a natural way of kind of like incorporating that element of this heart element, I like to call it. But for me, I used to feel I realized that my body was taking the stress, because I would go home and then I would feel people's pain, because that's, what we do. We mirror other people's pain. And that has changed a lot for me, because now it's a framework. It's a thing we do. We just do the intake, and then to see the changes that we can make, and to prepare women to go into a joyful, which is like unheard of, like a joyful birth, which it's incredible for women to say, I feel happy, I feel joyful. I mean, that has been such a difference. So thank you very much for asking me about that, Barri, because that's I'm so passionate about trying to get everybody to do this. Go, hey, we've got a way to do this. So thank you, Barri. Thank you. So I thought we would talk to you guys, and you've just been listening at your end. And if you had any comments, and you even like unmute yourself, because it's nice that we have such a small group, and then we can just have people talk. So who is here? I don't know how to do this, where you can like raise your hands. Maybe there's a place to raise your hands and tell us who you are, like, or just type down and type your name or me or something like that, so we can see you on the chat. Who is here interested in maybe having a midwife one day?
Hi, I'm Malika. I'm very interested in working with a midwife.
Okay, cool.
Yeah.
So what do you think of what we have said so far about the prenatal?
I kind of got emotional, because I've been seeing a midwife through an OBGYN's practice. And it's been it's still been where I'm seeing kind of whoever's on rotation that day. So really lacking in the more personable aspect. And definitely I can say my experience has aligned with that 7-minute, get your urine, get your vitals. Okay, we'll see you in 6 weeks, 4 weeks. And so I'm kind of coming to this late in the game, and probably not at the best time with all the COVID stuff, but
when are you due, may I ask?
I'm due at the end of July.
Okay, so I think you're not late. I mean, there are people who are coming in really like April, and that's getting it to be a bit difficult. But I feel like you could go to nymhomebirth.com and just look around, see our faces, and just go around and make inquiries. I feel like that is still time. I think there are still people.
Yeah.
I know us, for instance, we were planning to go to that big conference in Bali, which is now not a thing. So we had a room, to take new people. So you never know. And then I know that some of us, because of COVID, has had our clients who have country houses upstate or something, right, have moved upstate, and then we're like referring them to other midwives over there.
Okay.
So there is
still hope.
Yes, there is a yes. Don't give up on that. Like just because of that. No. Just go ahead and try. And people have spots. Then you're in a great spot. So
Great.
yeah, totally. Don't be afraid to keep asking. Because people do like change cancer well schedules do change. And
Yeah.
yeah, I know. And just regarding your this care where like if there are like 9 providers, they are then saying you have to meet every provider so that you're at the birth you'll be somebody and it goes back to our topic about birth. But it's like prenatal care is important. I mean, what's the value of birth if you've only seen that person once? I mean,
Right.
there could be so much value in you just seeing the same person, because then you feel like you're people getting to know you. Honestly, birth is something at the end of the day you do yourself, and I like to say just any idiot can catch a baby. That's how I say it, because like it's about when things go wrong that you really need us, because it's all fun and games for us, and you're doing all of that work. So I totally feel for you, because that rotation and that intention, which is good, which is like you have to see a different, that I think tends to make it feel very fragmented, and that you are now seeing a stranger with every visit, and that's
Yeah.
really hard.
Totally does. Yeah. Yeah. You hit the nail on the head. Yeah.
Yeah, and I'm sorry to hear.
So,
Yeah. Yeah, thank you so much for speaking
Thank you.
up and just being so honest about what you're going through. Is there anyone else who would like to? Oh, I have a
Kim,
Adriana.
I see here the chat because
Is
a
that
few
happening?
people.
Oh, let me.
Can you?
Oh, there you go. I'm sorry. Yes.
So I see Sylvia said she will consider
yeah.
having a wife.
Yeah, Sylvia, did you want to? No pressure. Did you want to ask us something, or did you want to speak?
As she says, she's currently just exploring.
Hi, hi everyone. Thank you so much. I'm currently 14 weeks, and it's something I've thought about in the past. I've spoken to my husband about it. And to be honest with you, not crazy about the interpersonal, I guess I want to say relationship with going to a doctor's appointment and checking in, and I need more time and I want to ask more questions, but I feel very intimidated because I feel like I'm being rushed.
Yeah.
And then I have a 6-year-old, and I didn't have such a terrible experience the first time. But it was my very first time, and I was very naive. I didn't know a lot of my rights, and it was just a lot of things that I know could have been prevented if I would have done the appropriate research beforehand. And it's just not that I kind of want to have control. It's just that I think maybe it would be a possibility that a home birth would be much more comfortable place, especially with this pandemic that's happening. And I know I'm due all the way in October. However, you never know. The news is saying it may come back in the fall. So I just want to prepare, and that's why I'm currently exploring.
Yeah. Does anybody have anything? The midwives have anything to say to her? I suddenly feel like I want to talk about the control thing. I think you have the right to feel in control.
I mean, we are having a baby. It's nice to have a little bit of control. In the hospital, it's just like, lay here. We're gonna put this monitor on you. Don't move, and we're gonna do a cesarean if we feel like you and the baby are. And you're like, why? Okay, fine, sure.
Yeah. Did you have a vaginal birth or a C-section?
I did have a vaginal birth. I had an epidural. I did not know how to handle my pain at all. I did have an epidural, however, I was hyperventilating from the pain, so they took some blood work to rule out preeclampsia, and they lost my blood work. I don't know how long I waited for a very long time, but that was very disappointing. And then to finally get the epidural and have this random doctor tell me, listen, you're a newbie, you're going to be pushing for hours. And if we feel like you and the baby are going to be in distress, I will perform a cesarean without no hesitation. And at this point, I'm so drugged up that I'm just like, yeah, sure, okay, you know, fine. And, you know, looking back at that, I don't want that to be another experience.
Yes. So the one thing I want to say for a second time mom is that we rarely transfer someone who has had a baby already.
We barely make it.
Yeah.
We barely
make it.
birth.
Yeah. So your chances, like, you know, I like to say to when people are asking what my transfer rates are, I'm like, it depends on whether you've had a baby. If you've not had a baby, if you've had a baby, literally, like, don't worry about it.
So, and also because, you know, it's a labor that goes much faster. Like Sylvia was saying, there's a lot of things now that I know that I didn't know back there, and one of them is definitely control. And then I just lost my thought. There was one more that I was going to say. Oh, it's some people feel like, oh, the first time I had so much pain and I used an epidural. Well, the thing is, when you're in a hospital and you're strapped to a bed and put all these devices and you're told you can only be in this position, of course it's going to be painful or sometimes even unbearable. At home, you will never see anyone that just naturally will lay down on the bed in labor on the back. It's very rare that you see someone that just naturally will adopt that position. Most women are, you know, hands and knees or squatting, because that position it's just very uncomfortable also for the labor.
Yeah. So, like, you know, so I think what we're trying to say is that you don't have to be hard on yourself for having had an epidural. You know, it's very hard to resist even, especially when things you get so uncomfortable, and when you're trying to labor and there's noise and there's that beeping machine and there's, you know, even when you're trying to stay focused and you don't feel comfortable vocalizing. I don't know why this slide is, sorry. You don't feel comfortable vocalizing and because people will rush in and say, are you sure you don't want an epidural, because they cannot stand the sound. The women make such a primal sound. You'll be surprised how uncomfortable people who work in labor delivery floors
Yeah.
are. The sound that you're making, you know, and in home birth, when we hear that sound, we just smile. We're like, she's doing well, she's making that sound, you know. So that's just is there anything you want to say, Barri?
Yeah, I mean, there's some good questions there. I like about there's some good questions, and I'm looking forward to getting to those. But the other thing that this is bringing up for me is that the prenatal care for the home birth midwife and the client is also all about making sure that it's appropriate and safe for her to have her baby at home. And so when people interview me, a lot of the times I say, well, I want you to have your baby at home. I'm a home birth midwife, but that is not something I'm promising. Now, I say that I don't often transfer people to the hospital, but even if we talk about all the different things that prenatal care can encompass in the home birth setting, the expansiveness of testing and shared decision making and parenting, the other piece is that prenatal care is there to make sure you and your baby are healthy. And so when you get to the time that you're in labor, that you have the confidence to know that you are in the right place with the right person giving birth. And so that's another part of our prenatal care. I hope I didn't put down doing the sugar test or drawing bloods or listening to your blood pressure, because those are really essential part of our prenatal care too.
Yeah. Yeah. Thank you so much for sharing with us, Sylvia. We have a great question. Please feel free to ask more questions. Just anyone, we're such a small group, it's so nice. You can ask as many questions as you want. We have a great question from Adriana. I'm interested to hear more about the prenatal experience for the partner.
Well, I would say I like it when partners are also part of the prenatal visit. In fact, I like it from the beginning when they come for the interview, for the initial consult. And because I personally, and I'm assuming many midwives like the partner to be in the same page, right? We want them to be as informed as the pregnant woman, so that we understand what the safety of the home birth relies on, and that they understand why we're doing all these testing. So in every visit, when we're talking about, okay, on the next visit, we're going to do the glucose test. This is why, this is how we'll do it. This is what happens if it's positive or if it's high. Then the partner is part of that conversation, and he also understands what's going on. It's not, I mean, yes, it's the woman who's taking control of everything, but he's also being a very important participant of this process. And even when the labor comes as well, he's going to be well prepared to know how to help her. So I feel that, you know, what I like when I get someone that emails me and say, my partner and I are pregnant, right? Because it's, right, even though we were talking before about mom and baby and the connection, but the partner shouldn't be left on the side, right? He's also part of that connection as well. It's the three of them. So I welcome partners to the prenatal visits. As you know, I try to accommodate my visits sometimes so that the partner can also be present, because I do believe that it's important for them to be there, and it's nice to have all these conversations with them included.
Yeah, it's we take care of moms who choose to parent alone, so there's not always a partner, and
Sure.
we have a lot of women-to-women couples, and we've also taken care of surrogates. And so just to expand the idea of partner, because I voice everything that Tania said, it's an amazing thing to be able to take care of the whole family. But to expand even on that question of partner, sometimes you get parents of the person that's pregnant who are maybe against the home birth or worried. And we've invited them to come to the prenatal visits to talk. It's been life-changing sometimes for the couple, the pregnant person, to hear, say, her mother talk about her own pregnancies and her own birth. So prenatal care, definitely of the partner, is so wonderful and joyous and inclusive. But we also have the ability sometimes to include other family members who may have questions, and then the pregnant person gets a lot of support from their family. And also the siblings. I mean, if there is one thing I am missing in this COVID-19 with the telehealth, it's going to people's houses and having their 3-year-old open the Doptone bag and listen to the baby and help measuring the belly, because I think our inclusive care really allows the older sibling to take ownership. And one of the most shocking things that I hear a lot of the time is how little jealousy there is between the sibling and the new baby. So I think that could probably be true with partners too.
Yeah.
So
Yeah, I mean, I think I had one sibling who has his doctor bag that he's waiting at the door. When the door opens, he comes, he's like, I'm here, very serious face, like, I'm here to help you. And so he does, I'll do the blood pressure on one side and then he'll do it on the other side. So I always give him something so that he knows that, and he has a serious face. And then as I'm leaving, he writes me this, like, you know, this card that comes with that, that gives you your next appointment. He writes that and then he gives it to me very seriously. So I have to take this. And I looked at it and it says baby on it. And it's like, so having them there is such a big part, like you said, Barry, is such a big part of their bonding. We already know that women will talk to their first child and they will like try to get them involved, but I think it adds another layer when they actually see and hear the heart tone and they see us do all the palpation and the touch, and they are often like, we had another sibling who was very annoyed during labor that we are not letting her listen to the baby, because all the prenatal visits she was in charge of listening to the baby, and we totally forgot about that because we're listening, because prenatal, like listening in labor is a whole different protocol, and we have to think, so we forget. And there was a sibling who looked like, wait, that's my job. And so that was so super cute. But I thought I would get back to the partner, it's so reassuring, I think, in a way, for the partner to see us, especially the ones that need to, they're being supportive because they know that's what their partner wants. They're the home birth, but they still have some reservations. I think it helps so much that they are there and they feel reassured. And I like to say, if the partner is happy, then the client is happy, right? If the woman with me, like her partner is nervous, she's going to be nervous. Really, at the end of the day, I still go back to our name of what our job means with women. And at the end of the day, it's all about trying to make our client happy. That's how I feel. So whatever it takes for anyone around, her biosphere to be supportive of her is important. And the other part is that, it is the partner's baby too. Right? They come into this relationship differently. I mean, they're not going to give birth, but they are going to be at the birth, and their whole experience is so unique, and not many people actually talk about what it's like to watch your partner do this thing, and it's so, it's phenomenal. It's how it affects them, and that needs to be a whole conversation, and we need to appreciate what it means to the partner to have that experience as well. I think there's so much to talk about in that subject alone, So yeah, did that answer? Maybe we told you more than you wanted to know. Adriana, was there?
No, I think that is very great. I would really like a home birth, and my husband is in the position where he's a little more unsure about it. So I'm how many weeks? I'm 11 weeks on Friday, so it's still a little, I'm still trying to figure out what I want to do, but that is helpful to hear.
Yeah, great. Thank you for asking.
If I could add, and also maybe that will get us into the next question that I saw Alexa also was asking. She says, I've always wanted to have a midwife, but my husband isn't interested. In my experience, the number one question that partners always ask at the consult is, I'm just concerned about the safety and what happens if, right? And I think once that part gets explained, I can see them being like, okay, now we can proceed, right? And so because we are in a culture where people don't usually talk about home births, then the idea is always like, you say I'm having a home birth, everybody's like, oh my God, but what if? And the truth is that, every midwife will always create a transfer plan with her client, and in the event that transfer needs to happen. And I also like to explain to them when do we transfer and what type of transfers we see more often, which is a labor just not progressing for the most part. But I also say yes, sometimes there can be emergency situations, and we come prepared to manage those situations for the most part. Like we bring medication with us to stop a hemorrhage, for example, right? Or if the baby needs help breathing, things like that. And then another point that I also make is that we are also trained to recognize when something is starting to deviate from normal, because that also it's the point when you want to start to bring that conversation. Look, this labor is not progressing, or maybe the baby's not responding well to the contractions, or things like that. And it's not that we wait for the very last minute when things are starting to get very complicated to transfer, right? We start to bring that up, and we all make a plan based on the circumstances. And I feel that sometimes just because that's the point that nobody ever answers, like the people that are not familiar with home birth don't know that answer, right? So when you finally explain that, it makes partners be like, oh, okay, so there is a plan in place. It's not just, we just don't, not that we don't know what we're doing, not that they think that we don't know what they're doing, but it's just not, it's abstract thinking sometimes. They just don't know what happens when things happen.
Yeah, I want to take this opportunity just to introduce Nicole as well, because she came on. And did you want to just say hi, Nicole, and introduce yourself? I'm going to unmute you. Oops. Unmute. It's not happening. Oh, there you go.
Hello, everyone. I'm Nicole. I'm part of NYC midwifery. I service Westchester and New York City for now. So I just want to say thank you for joining our panel. It's very nice to have you guys. I mean, this is an amazing panel. I mean, even though I'm here to talk, I'm learning a lot from everybody else too. So it's nice.
Thank you, Nicole.
Yeah. I have bad service, so I apologize. I'm like in and out.
Yeah, that's okay. Yeah, and I just want to add one more thing. That's a very important, point. What if my partner is not comfortable, right? I do tell people I'm happy to meet the partner when they come, but I do feel a little bit, for me, it's like I want to draw a line somewhere to say that this consult, this meeting is not necessarily about me convincing the partner that home birth is safe. This is a very key point that I want to make, because you have to come around to believing that, or believing that is the right thing to do, whether for whatever reason. And because you are the parent of this child, we think of you as just an essential part of who we're caring for. We're caring for family, and we're going to care for you. So we want to care for people who have accepted that this is going to be the care that we want to, what we're giving. So there is, the sober truth is that I do say that, and it's sometimes difficult because the woman may want to have home birth, but it's going to be harder for the partner to come around to it, and that's becomes a more difficult conversation to have, and it's not that clear cut. And sometimes, I've had fathers who at the end, after the baby is born, came up to me and said, I was worried the whole time. I was just pretending not to be worried because I know this would help her, but now I can see why this was so amazing. But he told me the truth. He was just putting up a good front because he knew that was important. So people come in all flavors, and I just want to put it out there that at the end of the day, we want some kind of commitment to this care. So sometimes partners is a thing that needs to be negotiated. You are nodding, Barry. You hope you have something to say about that?
Well, I think that if, risk factors, there's medical risk factors, but there's psychosocial risk factors also. And, but when it's rare that we do a consult where the woman wants a home birth 100% and the partner doesn't want a home birth or has really big doubts about it. But we take that time during the consult to ask each of them in their relationship what they will think. Because if they go to the hospital, if she doesn't want to go to the hospital, they go to the hospital and something happens, how will their relationship feel about that? Yeah. And I always bring that up because the conversation's always, well, how will you feel if something happens at a home birth? But you've got to open it up to, well, what if something happens at the hospital? Which with the interventions is, I think, and I say this so much, I feel like I'm playing one of the songs on the album of my consults. But many people, they ask me all the time, what's the risk of having a baby at home? And we go through everything we've just talked about. But then I ask them to ask themselves, what's the risk of having a baby in a hospital? It's not as if it's risk alone. It's risk. There's some risk to being at home. I mean, there's risk to getting pregnant. And I didn't have anything to do with that. So you got pregnant and you already have some risk. But you have to look at the risk at home, and then you have to look at the hospital. And a lot of times when we talk about the risk of going to the hospital pre-COVID, partners actually start to think, oh, it's not, there's risk at home and it's totally safe if we go to the hospital. So that's what I was thinking about.
Yeah. And at the end of the day, that word safe, like it really, at the end of the day, that's what it's all about. You need to give birth where you feel safe, whether or not it's a home or a hospital, because if you're afraid, that's not helpful at all. You know, if you're scared and you don't trust what it is you're doing, it's not helpful. So, and it can actually put you at risk for other things, because a woman who feels unsafe, her labor will not progress. It's a very simple science. The biology of stress hormones. Stress hormones are the antagonists to oxytocin, and oxytocin is the fuel that causes your uterus to contract. So if they are, the two hormones cannot coexist. You cannot feel safe. If you cannot feel safe, your body cannot produce oxytocin. So that safety part is such a big part. And this is the conversation since COVID, and we've had this kind of rush, you know, this pandemic. And I made a joke. I wanted to write an article called From Pariah to Diva in One Pandemic Night, because that's the home birth experience, because a lot of us, we are so mysterious. Nobody knows who we are. And there's a lot of, I mean, our clients love us, but everyone goes, oh, and then suddenly we're divas, you know, and it's like, it's very confusing for us because, you know, suddenly the hospital is no longer a safe place. And we recognize that if you don't think the hospital is a safe place, maybe home birth is right for you, except for the fact that there are other factors that we had to take into consideration, is that we don't know where your baby's been, because we're going back to prenatal care. Prenatal care is where the work is. And if you're coming and you have 1 week before your due date, there is a lot of stuff that we wonder about and that we don't know. And I haven't touched that baby. I don't know where the baby's position is. I don't know how the baby has been growing. You know, I don't know so many things, and it's taken us out of our rhythm a little bit, because our rhythm is like, you know, like I maybe can speak for everybody here. We have a set way that we do. We have a first consult. It's like a first date, and then we decide if we should have a relationship. You know, we have all these things that we're you know, established for such a long time that we're doing, and suddenly there's a tsunami, or there's a, you know, our boat is being rocked, and we're like, whoa, what's going on here? Just coming to wrap around the idea of safety, you know, that both of you have to some degree believe that it's the right thing to do and embrace it.
We had one question, and maybe Alexa has left, but it's a great question because I see so many second-time moms for consults, and it's does being induced for baby one make a difference with labor and birthing baby two? And I would say no. That it, I mean, the psychosocial aspect of her being induced might impact how she approaches labor number two, and it depends on what she was induced for. Was it a valid reason like preeclampsia, or was it something like you're at 40 weeks and your doctors or somebody's going away? So,
Jesus.
Yeah. Yeah, and so intrauterine growth retardation, which is IUGR, can be a valid reason. The baby is not getting enough to eat on the inside, and it's good to get it on the outside so it can start breastfeeding and eating on the outside. But that doesn't necessarily affect your next labor. You would be monitored more closely for fetal growth.
Yes. Yeah. So Alexa has followed up with saying that it was induction for IUGR, which means intrauterine growth restriction, meaning that the baby it's not growing in for whatever reason in as much or as fast as they should, and it might actually be more beneficial for the baby to be born sooner so that it can get the sustenance that it needs. So the answer, I think, to your question, Alexa, and I know you've come to me and we've been friends for a while too, is that it depends on whether or not this is an IUGR again or not, and the risk factors are a lot more like complicated than that. But the key is that, you know, you shouldn't go and like have someone talk to you about IUGR so that you don't, at the very least, you don't feel worried. Is my second child going to be IUGR? So that will take some of that stress away. That's to have that reassurance. And as far as I think the induction, we all agree that is usually if you're induced, there's no straight line between a previous induction and how your labor is going to go the second time. Am I right, ladies?
Yeah, I agree. I mean, the body has memory. So if she was induced the first time, she ended up having a successful vaginal delivery, then when she goes into labor the next time spontaneously, because we just, if everything is okay, we just wait, and then labor starts on its own. The body will just remember, oh, I've done this before. And she says hers was 12-hour labor with an induction. Well, it just, it could be so many factors that made that labor been 12 hours. Had it not been induced, it could have been, less, more, who knows. But the truth is that, like Barri and Kimm had said, like not necessarily Kimm was a factor. So not necessarily this time you're going to need to be induced unless your baby's not growing adequately. And if you go, then there's also a chance that you just go into labor spontaneously, and you have a beautiful vaginal delivery.
And I think, Alexa, it's really important for you to know that this experience is likely to be completely different one way or the other, and that sometimes when you've had a previous trauma, you tend to, and that's normal, to try to compare your current experience with your previous experience. It's just trauma talking, because you're like, oh, that happened, will it happen again? And it's okay to recognize that and to say, yes, there is a reason why you're worried. But at the end of the day, what we can tell you is that it's totally unpredictable. It's like a whole new, like it's a like play over again. Like it's not, there are some research on some links, but not enough for you to be too concerned about in terms of one thing linking to the next thing. Right? Great. So I was also wondering if there's anyone here who isn't, or who's a doula or a birth worker, or who wants to ask us a question or make a comment. You're very welcome, Alexa.
Somebody said, Amanda said, I'm looking to become a midwife.
Oh, yeah. Great, Amanda, are you sure?
She's still there. Yeah, she's.
Are you now that you've heard what we've said, you still want to become a midwife?
Oh yes. Even after I have gone through my baby's now 6 months, I have my second child. We were actually a transferred home birth on the second. So we ended up transferred to a hospital, but all well and good, healthy mom and baby at the end. That's the ultimate goal. And so I still am looking to go into, I'm taking my prerequisite courses now to become a midwife, to enter into a program. Yes. So I'm just here trying to get as much knowledge and insight and just little factoids to go along with all of the wisdom that everyone has to give.
Great. I'm so glad you can get some what I like to call the true midwifery component of care. I may speak for us that's what midwifery is about, because I like to say, now I'm on my soapbox again, but I won't take too long. I like to say that what makes us a midwife is often left to us to identify, because when we are in school, they don't really teach us how to be a midwife. They teach us how to be a doctor. Right? Everything we've learned is all about what the worst case scenario, which is a good thing. Now we know the worst case scenario and we can handle it.
Right.
But then people have often asked, what defines a midwife? And ACNM, our sort of big body there up there, who often speaks for us. So that's what they think they do. Somebody else. They often put out videos that are like, they put out competitions, and students will put out videos. What is a midwife? What does a midwife do? And they're often saying things like, oh, I can write prescription. I can, give you Pitocin. I can, you can have an epidural when you're in my care. You can do this. And I always laugh and I say, well, that's what makes you a doctor. We know that midwives can do that, but what makes you a midwife is what I'm always like in the back of my mind going, but what makes you a midwife, right? And so like I take pride in this home birth. I never thought I would become a home birth midwife, because when I went into school, I thought these crazy home birth midwives, I want nothing to do with them. I swear. Somebody actually went to a training with a home birth midwife. I'm like, what is she gonna learn? I just wanted to wear a white coat, have a clipboard. I don't know why I thought a clipboard was part of my
There you have it.
repertoire. Look, I have a I thought I was gonna, I was going to go in and bless every room, like with my amazing midwifery care, which I had no idea what that meant. So I think we're left to define what midwifery is, and I think maybe you guys can add on. Becoming a home birth midwife has really forced us to define what that is, right? Because we have to be with women, that and that's just, I think, wonderful. And I would never have come around to being a midwife because I was so adamant. The only reason I became a home birth midwife is because I worked in the hospitals and I couldn't get along with anyone. And every time there was a woman not getting the exact care, I was mad, and I was writing letters and trying to, move up the chain of command, trying to get somebody to listen, and nobody liked me. So then I was desperate, and I became a home birth midwife. But you never know what your life is going to be like, and it just turned out to be the most difficult and the best job that I've ever done. So I just thought I would sit on the soapbox for a while and talk about.
Well, thanks for sharing your story.
But yeah. So we have another comment from a Simone J. I'm a doula thinking of becoming a midwife. I have no questions, but this is very helpful. Okay.
We're glad it's helpful. We're glad you're learning something from these three crazy midwives.
The crazy. Now we're in demand because nobody wants. Okay.
No, we're not crazy.
I'm going to be on the soapbox again, but really this has to do with truly what birth is about. I heard a comment recently that I saw that the hospitals are not prioritizing labor and delivery anymore because the labor and delivery floors have become COVID floors, and they are transferring and funneling pregnant women or laboring women to all these other places. And I made a comment. I said, well, I have that in writing, that birth is not a medical event? Because now, before, you always said that birth is a medical event and it has to happen in the hospital. Well, when push comes to shove and there are real concerns, suddenly midwives are not essential and birthing women are not medical, they don't need medical help. So I want that written on paper so that when this pandemic is over, I want us all to revisit that statement and let's talk about how we can truly provide safe care for all women, meaning we can have access to hospitals when we need it, but then the rest of the time we can put them in a place that's safe and a care that is a true midwifery care. So that's another thing. So thank you. Two things. Two times I was on the soapbox. Yeah. Malika, how much on average? We actually spoke about that at length, about the cost of a home birth. If you look at was it our first or our second? The first one, yes. So we're putting this on YouTube so that this information is available to everyone. And so I think it might be helpful for you to look through when you go to NY Homebirth, you can, maybe it has a link to our YouTube channel and you can see, or follow our Facebook, New York NYC Homebirth Midwives, that's our Facebook. And then we're going to put a link to the YouTube channel so you can see everything. Okay, you're welcome, Malika. So any other comments from my colleagues?
It's great to share with everybody.
Yes. This is such fun. We never get to do this, you know.
Yeah.
We talk politics, we talk, you know, things, but we never actually got to talk about the heart of our work. And I feel like we've taken this opportunity not only to talk about it, but to engage with other people who are, not that, so that we're not this like group of mysterious gray-haired women, you know, but that we actually are very logical in our approach.
Yeah, I like that. Oh, sorry. Go ahead,
Okay.
Barry.
But I was just going to say, it's this also is the feeling that the last thing to say about prenatal care, that it's really joyous, that we get to have we get to really enjoy what we do, and I am honored to have the privilege to be able to practice this way, and it's very fun to do it with my colleagues.
Yes, it's so nice.
Somebody just added something.
Well, I asked my OBGYN, in case of emergency, is I can bypass the ER and avoid being potential. Oh, yes. Go straight into labor. Sorry, I'm just reading very fast. Yes, that's right. That's right. Sylvia has begun to realize when she's been talking about what her options are, that she was no longer a priority. Yeah, that is the sad. I'm so mad because they keep saying that that birth is a medical event, and now they let women believe that, and women go into hospitals expecting to be cared for, and now they're like, no, you're not that important. Ah! Yeah, I am so sorry to hear that, Sylvia. I'm just terrible. Yeah.
Well, that's what they said. There was this, I don't know if any of you saw it, there's a little short that Nuranisa sent me.
Yes.
And it says, midwifery is the best kept secret.
Yeah.
And that's at the beginning of the Homebirth, I think it said it's the best kept secret. And so I was like, oh, I like that, you know. And so that's what it makes me happy, that we are able to have these meetups, virtual meetups, to really be able to communicate. I think it was time for us to not be the hidden, you know, midwives like that.
Gem. The hidden gem.
Yeah. You know, but now we can just like, hey, you know, this is what we do. Instead of everybody talking about us, then it's better that they hear directly from us, right? And and I think it's great that we have this opportunity to do this.
Yeah. I just wanted to say a hi to Supriya.
Hi, I was just gonna say, we're having our first kid, and we just signed on with Kimm and Kathleen, and I have my first appointment tomorrow, so I'm very excited.
Very nice.
Thank you for doing this. Sorry I signed on late. And I think Tania, my Rolfer, might have seen you for her first labor, Miriam. So I think, Tania, maybe Tania, I believe. I don't know.
Is the other Tania, because I don't remember Miriam. There's two Tania.
But anyway, I'm very excited, and thank you for doing this.
Yes, I'm so glad you could join us, because it's just nice to like talk about birth in this very sort of birth-centric environment, because it's such a special topic, and it's such an important topic that has often just been marginalized, because the experience of women is not as, never been valued, and we think it is just so valuable, coming around to the topic of this being prenatal care, that this whole, like Barry saying, like how enjoyable it is. It's such a big part of our care. And
thank you.
Yeah. Yes. So so before we close up, I want to thank everybody for coming. Did anyone have anything, any comments that they want to make, any questions? Feel free to just type in there or unmute yourself and speak up. Otherwise we will try to see you again in our next webinar. We're going to talk about the same thing, the home birth difference, but then we're going to be talking about labor which is what everybody wants to know about. Prenatal care, they're kind of like, okay, but labor, everybody wants to know. So I think that'll be great. I think it'll be awesome to talk about it. Okay, so thanks very much, Barri and Tania, for coming, and we will have
Thank
this.
you.
We will have this video up on YouTube too. Okay, so great.
Thank you, everyone.
Bye.
Night.
Good night, everyone. Good night. Good night. Take care. Bye.